few years ago, I met a friend who's also a doctor in the park while I was jogging. He told that about 3 weeks earlier he had had a blunt trauma to his index finger and had gone to the hospital. They took an x-ray, but the doctor said everything was right. When I saw him, he had a swelling and pain on the back of the PIP, exactly as this one. The PIP was slightly bent, already tending to stiffness, as you can see in this picture. That is not the actual one. He then showed me the x-ray that was in his car, and it was possible to see an avulsion of the central band of the extensor tendon with a bony fragment, similar to this x-ray you are spotting, but the true case revealed a smaller fragment than this. The diagnosis was then a Boutonniere deformity. We started a conservative treatment even with this time, and it ran very well. However, if it had not been treated, it would be possible that he would have a permanent deformity, very difficult to sort out, with severe impairment, not only of the affected finger, but also the whole hand. Then be warned that this type of injury cannot go unnoticed. And what is this about? Zone 3 extensor injury, otherwise known as Boutonniere deformity, is caused by this disruption of the central slip at the proximal interphalangeal joint, exactly as you can see here. Then, absent or weak active extension of the PIP is a positive finding. This can be assessed by the Elson test, and active extension is retained at first by the lateral bands, but the head of the proximal phalanx eventually goes through the central slip, leading to migration of the lateral bands, as you can see here, the bands. This then results in deformity with loss of extension at the PIP and hyperextension at the DIP joint. It can be closed or open injury, and the central slip may avulse with or without the bony fragment. However, the physician must suspect that there is an injury, even under a normal x-ray. The Boutonniere usually occurs 10 to 14 days after the first injury. That is to say that if a patient presents with a swelling and pain in the dorsum of the PIP joint, even in the first days, you must start the appropriate conservative treatment. Don't delay it. Don't delay it. Otherwise, you have a major complication. Closed deformity require spleening for 4 to 6 weeks at the PIP joint and extension with the PIP here, as you can see, and wrist joints left free, and also the DIP joint can be left free. You can also use this kind of spleen that's very effective for this kind of injury. Thank you.